All right, so this is the knee, thigh, hip, and pelvis. We had Martha, Melanie, David submitted this huge file. This is a huge area. That's why they had 3 people, because there's so much on there. I'm going to try to pare it down a little bit to give you guys an idea of really what to focus on as we go through. So my face is gone. We'll click through as we go through their presentation. The first couple slides I'm going to kind of cruise through until we get to this area right here. So these are good, the iliac crest, the 2 iliac crests, and then on the ilium itself, there's a posterior and a superior spine that you'll need to know. Definitely the ischial tuberosities are super important. You'll see that especially when we get to the hamstring muscles on that ischial bone. And then in the front here, well, let's go back to here. This talks about more of it, same kind of information. Here's your pubic symphysis as you talk about it. The specific bones of each side of the pelvis, you should know those, right? And so this is kind of a probably a reminder. Oh yeah, there's 3 bones that are fused together. I'm not going to really focus on the acetabulum. You should just have an idea of the three bones themselves. The acetabulum here is your hip socket. That is where this guy goes, the femur. And you have quite a bit, since this is, you're talking about the proximal and distal landmarks for that. So up here, really the head and neck, that's easy. And then these 2 bumps here, greater, lesser trochanter kind of peeking out there. And then as we get down to the distal part, I want to talk about the definitely the medial and in fact, I'm going to get you another view here, another picture. When you get to the condyles and epicondyles, look at this. So this is the posterior view right here. These 2 big bulbous round things, these are the condyles. Those are the femoral condyles that you have there. And you'd have the medial lateral femoral condyle. The epicondyles are just a little bit up right there. So when you're actually palpating, you'll be looking, most likely you'll get that epicondyle as an easy one. The condyle itself is that big round kind of bulbous. So make sure you differentiate those 2 as well. There is a linea aspera that becomes an important one for muscle attachment, especially when we get into the quadriceps and other muscles themselves. When we get down to the knee from the bones, it's just the distal femur, proximal tibia. Fibula is out there hanging out watching, and then definitely we have the patella that's right there. When we get to the back to the joints, I won't be too hard. In fact, I'm probably not even going to ask you about the sacrococcygeal. I won't ask you about the lumbosacral. Those are 2 joints you'll need to know eventually, but not for this class. I think for us, I'm going to look at just identifying that there is a sacroiliac joint. Again, depending on where I'm pointing, I will ask you, name the joint that I'm pointing to. If I didn't have joint in there, if I just said name the structure, you could probably get away with just, oh, that's the sacrum, coolum. Yes, that is the sacrum that I'm pointing to, unless I say, what's the joint? All right, so that's how it works. Works there. A little bit bigger picture as we go, and then we go into the coxifemoral or the hip joint itself as we go through there, and you can see that here's the main motions and the degrees with some pictures that kind of identify what those motions are. You need to know what those motions are as you go through there. It is important to recognize the patellofemoral, so that patella does glide on the femur, that trochlear groove. So that's another one that you need to know, trochlear groove. The patella, that's the posterior part of the patella, is a patellofemoral joint. And so you need to know that is, that's what we're talking about right there. When we talk about knee motions, we talked about hip, now we talk about the knee motion. 2 main motions. I could throw in some rotation and varus and valgus kind of stuff for you, but the main motions that we deal with are flexion extension. So you can pretty much see the tibiofemoral joint gives us our flexion and extension. Now, wherever there is a joint, there usually follows that there is a ligament. So we go back up to that coxifemoral joint, and boom, there it is. There's some ligaments here. Basically, just knowing the existence of these ligaments is important. I'm not going to ask you the actual, what they limit. It's good to know. You'll need to know it eventually. I just want you to have an idea that they're there. as we go through. The other, this is more of a fascia, this IT band fascia. It's ligamentous tissue, and it's not really categorized as ligament, but it's the same kind of tissue. So I do want you to have an idea of the IT band, and not only that it exists, but also obviously where to find it. And action, it's action you do need to know. It's a lateral stabilizer at the knee itself. When we get into the knee, this is the four main ligaments. You had the collateral ligaments on the outside, collateral, right? So medial collateral from tibia to femur, lateral from femur to fibula. Those are our varus and valgus forces, and then our posterior and anterior cruciate ligament. Anterior is easy because right in front. Posterior is hiding. I don't even see him in this one. There's plenty of other pictures that we have that can show that. Ultimately, when you look at what they do, you will have to know for these four ligaments what they limit. Like the hip ones, I don't really, not going to stress about this right now. I am going to stress about this. I do want you to know what the ACL does, the PCL, MCL, and LCL, what that does. On the valgus and varus stress, if you haven't had it, or even if you had, here's a reminder, just to give you an idea that varus force is that lateral force. So when we bring this in and we open up this side of the joint, and then the valgus is much more common at the knee. We take the distal portion of the extremity, move it outwards, and that opens up or stretches the medial side. So valgus is always medial force, varus is always lateral force. Make sure you remember that. All right, let's get into some general muscle stuff. Boom. Starting off with the big dog, the iliopsoas. This is two muscles. You can see the iliacus here comes from the iliac fossa. Here's our psoas major, and this is our hip flexor. Flexes the thigh. There you go. It does do some trunk and stabilization, but we're going to be focused on what it does at the hip. Piriformis is one. There's so many deep little muscles in here, and this group got really, really intricate and did a lot of good detail. I took it out. I'm sorry. I ruined all your hard work. But really, for this class, if I want you to know stuff, I'm picking on the ones that I feel are super important and super common. Piriformis is one of them that I really want you to have a good idea of in this deep area. As we get more superficial, we'll talk about gluteus medius and gluteus maximus. Here's your maximus. Make sure you have an idea of here's where it originates and starts. I really want you to know the action for this one. So there's your identification of gluteus maximus. Right underneath is that gluteus medius. Make sure you have abduction and really internal rotation. Not too much on the stabilization of the pelvis right now. And actually, in certain positions, it actually becomes an external rotator. But let's just focus for right now on abduction, internal rotation. Gluteus medius is actually my favorite muscle. So just so you know that. There's a number of adductor muscles. There's about 4 or 5 little adductor muscles. I just picked the big dog, the magnus muscle. I kind of threw out the rest of their work. They had it again. They did a good job. So make sure you know the adduction, right? So that's easy on the adduction right here. As we get into the muscles of the thigh that act on the knee, we start with the quadriceps muscles, right? And so you get all the vastus muscles, medialis, lateralis, and then there's going to be an intermedius, rectus femoris. Make sure you know that this should say, this is all extension of the knee, all extension of the knee. When I go to the next one, there's your rectus femoris. Vastus intermedius is right there, extension of the knee, and then extension of knee and flexion of hip. Make sure you note that on the rectus femoris because it does cross the hip. It comes from the anterior inferior iliac spine. So it comes from the ilium and crosses the knee. They all go into that patellar tendon to the tibial tuberosity. All right. Then then the other one in that anterior compartment is that sartorius. So you can see that. That's the pes anserine down there. So that you'll learn that. But ultimately, that on the gracilis, on the medial side, that's one of those superficial muscles that adducts, adduction of the hip, and inserts at that same pes anserine area. And then we have that this is the IT band part. This should actually be white because this is IT band. The tensor fascia lata is the muscle at the very top of that IT band. So make sure you know abduction of the hip as that goes through. Then you get into the hamstring muscles, and so we start with the medial hamstring muscles. You can see semitendinosus right here. They all are going to originate off the ischial tuberosity, and then depending on where they are, it's either going to be on the tibia or the fibula as their insertion. So semitendinosus is this one right here. I gave you another picture of the semitendinosus. This one I want to emphasize this long, skinny tendon. It becomes a tendon early and has this long, skinny tendon. Sometimes that's how you can differentiate between semitendinosus and the next one, which is your semimembranosus right there. Same ones here. There's your semimembranosus kind of underneath there. And then here's that same picture. The semitendinosus is gone. This one's much more broad and flat as you go through. The lateral hamstrings is going to be your biceps femoris. There is actually two heads. I should have put the other head in there. This is the long head of the biceps. There's another portion of the biceps that just comes from the femur, and it didn't include that. You'll get there. But again, this is that head of the fibula, and then there's your biceps femoris, and here's the second picture, lateral side going to that head of the fib. Then we get into some of the other structures. So the bursa, again, I'm not going to pick on individual bursa and have you identify them, just knowing that there's bursa there. There's that tensor fascia lata we already talked about. I've already talked about the IT band or iliotibial band as you talk about. There's bursa in the knee that you'll come in contact with. Not for this time right now, so don't spend too much time. I did talk about the pes anserine and the gracilis and sartorius muscle. Here's the semitendinosus of the hamstring. So I do want you to have an idea of the pes anserine, which is on this medial side of the tibia. And then the other side of the tibia, the lateral side of the tibia, is this Gerdy's tubercle. I want you to know that. That is where the IT band, inserts. So there's that. So no pes anserine and no Gerdy's tubercle. I promise I'm going to ask those. So please know those. And then we'll wrap up with the other structures before we get to that stuff with the two meniscus. You have a medial, have a lateral meniscus, and this is the top view to kind of give me an idea. But just note medial, lateral meniscus. When you get into the neurovascular structures, I think the biggest one I want you to know is the femoral nerve, sciatic nerve in the back, yes, femoral nerve in the front, sciatic nerve in the back. There is an obturator nerve that goes through that obturator foramen. But know those two big ones right there, and there's that. Don't worry about the supragluteal. I do want you to know the sciatic nerve as you go through, and there's that. There's a bigger version of both those as you get through there. This is one of those pictures that show you just how much and how big the neurovascular structures are in that femoral nerve. It's a big old nerve, two big old arteries and veins that come through there, femoral artery and vein as you get through there. And then when you get down to the knee, I've talked about it, I'll talk about this later too, but definitely popliteal artery right in behind the knee. And then this is sciatic nerve up here, and when it splits into common peroneal and then the tibial nerve. So that's what you'll need to know. And then you'll look at the lower leg information for more of their stuff. All right, then I go through just like all of them, and I've given you a number of different ways. This is a good one of the PCL right there. PCL right there, because this is the posterior side. But again, that you can go through and identify all of these things, good IT band, that kind of stuff.